everyone, I just thought I'd share some final thoughts on how do we move forward in terms of race and ethnicity and health outcomes. So let me share my screen here. So just to summarize what we've been talking about, Black residents face the greatest social, economic, and environmental hardships and consequently have the highest rates of acute and chronic disease, injury, and disability, and ultimately lower life expectancy, right? So what we have here is essentially that social determinants of health, things much bigger than eating an apple, taking a walk, getting enough sleep, are disproportionately impacting Black Americans negatively in terms of their health, right? So that's what we've been talking about. So what do we do about that, right? How do we move the needle? How do we lower infant and maternal mortality rates for Black mothers and babies? How do we lower the death rate from COVID-19 for Black Americans? That's a big question, and I'm not going to pretend to answer it all here, but I just wanted to share some food for thought as we think about moving forward. This is a really complicated graph here that I've included on our page, but I kind of wanted to walk you through it. This is a graph I got from the public health sector in our, that's very much playing a role in this pandemic right now. So what we have, let's go over here to the right? This is what they call sort of downstream, right? Mortality rates, right? People dying, how long people are expected to live, infant mortality rates. So this is sort of the end. So our question, of course, is what's causing all these things? Of course, disease and injury cause people to die, but if we have to move back from that, what's causing disease, what's causing injury? And here's where we get stuck, right? Here's the biography that people engaging in, quote, risky behaviors, right? Not exercising enough, smoking, drinking too much, having high blood pressure, getting diabetes, these sorts of things, right? So this is where we've gotten stuck. Our conversation thus far, though, is focused on this, right? That are the social determinants of health, right? Where we live, if we have reliable transportation, if we have a steady job, if we have health insurance, these sorts of things are going to impact behavior, which is going to impact chances of disease and injury, which of course impacts our mortality rate. Right, so this is what we've been talking about. But remember, conflict theory pushes us to, well, why are these things distributed unequally, right? Why do disproportionately Black and brown people live in low income and therefore dangerous neighborhoods? What's going on there? And if we keep going back, right, we look at institutional inequities, right? Looking at the role of education, looking at the economy, looking at government policies that have unequally distributed these living condition resources. Well, what's at the root of that, right? Why do we see higher rates of wealthy whites going to fancy four-year colleges and universities and not Black and brown people, right? Why do we see these inequities in our social institutions? And that goes all the way back here, right? Classism, racism, homophobia, sexism, misogyny, right? So conflict theory really underscores that what's at the root of these social determinants of health are these social inequities. So if we're trying to answer our question, how do we deal with high rates of Black infant mortality? How do we deal with high rates of Blacks dying from COVID-19? This model suggests we've got to get over here, right? Simply telling people to wash their hands or take a walk isn't going to solve these problems. So with that said, just to remind you, right, that racism acts at these different levels. So on one hand, right, we have interpersonal, right, what's going on between individuals, institutional, and systemic. And what I wanted to talk about real quickly is just some thoughts on what we can do on these different levels to address these health inequities that we've been talking about this week. So this is by no means an exhaustive list. In fact, I urge you to take Soc 25, Sociology of Minorities, as we take a lot more time to talk about this, and we'll be chatting about it a little bit more in a week or two. But just some ideas, right? What can we do on an interpersonal level, right? In the kinds of interactions we have? Well, if you took me up on that extra credit, recognize our own implicit bias, right? What are our own sort of stereotypes about different groups that tend to shape our behavior in ways that we're not aware of, right? So taking some time to reflect on what those are. Institutional racism, how can we deal with that? Well, you've probably been hearing lots of calls for universal health care. We saw all those other countries, Japan, Switzerland, Germany, they offer healthcare in very different ways, but what they all have in common is they have universal healthcare. Everybody has access to it, right? It's not a matter of if you have a job. It's not a matter of if you have enough money. Everybody has access to healthcare. That could be one example of addressing institutional racism in medicine. Systematic racism, remember, is this sort of 30,000-foot level. What can we do systematically, right, that will positively impact our institutions and our behavior? And that got me thinking to what we've been seeing lately in calls for the taking down of Confederate statues and changing symbols on flags. And on one level that can seem sort of superficial and just sort of wallpaper, if you will. But that's actually, I would argue, an example of systematic racism, right? This kind of reckoning as a country with the very long history of racial inequality in the United States, right? Having that kind of reflective, bigger conversation about the role racism has and continues to play at every level in society. So some food for thought. I know it's unsatisfying. There's not one simple solution to these problems we've been outlining this week, but I do hope it's given you some food for thought. All right, take care. Looking forward to the conversation.